first of all, there's always a acute effect of you could have some sepsis, you could have leakage of urine, there's always risk of death with surgery, although it's very, very low in this modern age. Erectile dysfunction is, again, a problem in all of the treatments of prostate cancer, not only surgery. When you're doing an open prostatectomy, men go home often after a day or two stay in the hospital with a catheter, usually for a couple of weeks. If you're having a robotic prostatectomy, the recovery time is less. The catheter is only a much shorter time, like less than a week, and you're able to go back to work in 1 to 2 weeks, where an open prostatectomy is just like an open belly surgery, and it has to heal up, and probably you're out of work, closer to a month. Radiation therapy has many effects. There's acute effects as you're getting radiation therapy, any kind of beam to your abdomen. There's your bowel and your bladder are very close to your prostate, how our bodies are. So you can't move those things out of the way, and therefore they get some radiation. You can have some urinary effects, burning, frequency of urination right during treatment, and you can have some bowel effects if some of your bowels getting a little bit of radiation, a little bit of diarrhea. I would have to say active surveillance, there really is no side effect, but then there's always the risk. Are you not catching the cancer fast enough? But then the other benefit of an active surveillance is that you're putting off, if you do need treatment, until the cancer, that switch has changed, as Vanna said, you're putting off any side effects of treatment so that you're still continuing to have your normal lifestyle. They're really trying to get to the bottom of what's best. Are we going to miss out on patients if we're doing active surveillance? And they want to do a head-to-head trial on those things because you can't just retrospectively look at data and come out with all the same conclusion and given all the equal ground. The other things that might be in our future are going to be many of the tumor markers, DNA testing, and maybe even in the future, as our imaging, our MRI techniques and things improve, maybe those will even stop prostate biopsies. Maybe we'll be able to tell much more from those things.